the infection risk. Do we want to educate, them on diet and cooking their foods adequately? Yes. That all falls into there. The gas exchange, we can think of the ones like TB, we can think of the pneumonia, we can think of those things that cause issues with gas exchange. They kind of went over about pneumocystic gyrovac pneumonia, but those things, adequate rest periods, things that we're doing for support of the patient, breathing treatments they may take. That One thing that I want you guys to know, we always want to have oxygen available to a patient. When a patient's short of breath, when do we know when they need oxygen? How do we check that?
O2 sat.
Yes. Just because somebody's saying they're having difficulty with breathing doesn't mean we just automatically put that on there. We need to check we have to assess before we just do that. Managing pain. So sometimes when the patients get things like neuropathy, and they have pain instead of maybe the numbness, things that we can do, the gabapentin, we can do Lyrica or Elavil. These are things that we can add to the patient to help them with their pain. Other things we may do is, they may do like massage therapy. Maybe they need a better mattress pad, things like that help them be better. Hydrotherapy is also really great for these patients. Going into a little bit more detail about the nutrition. So again, I went over if somebody has yeast, they may do like the diflucan, or women may tend to get yeast, in their vaginal area. So they do have like over-the-counter monostat, things like that we can also do for these patients. With the wasting syndrome, again, 2 to 3 liters of fluid is usually what we ask them, unless they have a fluid limit that they have. I don't want to repeat things you've already said. Diarrhea. So if they have diarrhea, but if they have diarrhea, what do we need to assess? Every shift we need to be assessing their perineal area. For breakdown, skin breakdown, we shouldn't just, they have diarrhea, they're fine. Because even in children, if children get this, they get excoriated, and that's the same way as adults do. Monitoring their electrolytes is very important, and making sure that they're taking in that fluid and stuff. So we need to just monitor those things. Restoring skin integrity. So they talked about sarcoma. So just kind of review that stuff, because that commonly occurs with these patients. And then enhancing the cognition and psychosocial distress. So they went over those as well. Community-based, you just can review these things, family arrangements, going over, making sure that they have, a support system. If they need a support system, we can do those things as well. And then I want to go over these little questions. We have 5 minutes to do this. So review this, and then tell me what your answer is. C, yes. So you need to know those levels in order to understand which stage they're in. So why is multiple drugs needed instead of just one? Yes, for resistance. Why would we do A?
Citrus.
Why would we do C?
It's hot.
Hot. If it said like a mild warm soup, but those key words, because I would think, oh, soup, that's great, right? But you can't miss those words that are saying the soup is really wrong. Rinse your mouth often with commercial mouthwash. Alcohol. So commercial gives, I like that. Now, this one always trips people up. Let's see if you remember what I said. So what all? A, A, C, D, and E. Yeah, because they do have. Why wouldn't it be B?
Because that's only for HIV.
Yes, yes. It's an assessment for HIV. It's not an assessment for AIDS. Oh man, I put this on a test one time and I got screwed. But I said it in class, but and then I put it on here to like, this is like a English test question, and that's why I want people to understand is that the Western blot, the ELISA test, those do not tell us anything. Now, if I put a CD4 of 194, yeah, that's helpful, but not that test. A patient is fearful that he has been infected with HIV and recognizes visions or symptoms associated with possible HIV.
C.
Yeah, they have to kind of move flu-like symptoms. PPD skin test. When did they come back to the office? Yeah, 48, 72 hours. 48-year-old homeless man living in a local homeless shelter, active IV drug user, arrived at clinic for a CBD to be assessed. What's the positive result?
A.
Wow.
It's high risk.
As a nurse, you know that one of the reasons for an increase in multi-drug resistance is why. This is book 9. You're all chapter 17. Now be prepared. I want you to study up because Monday I do want to do a lot of the case studies. That is going to be you all kind of telling what's going on with patients.